Hey, Dr. AJ here. If you have arthritis, exercise is one of the best ways to improve your pain, but that's really difficult with stiff and painful joints. Luckily, there's an easier way to do this using a simple vitamin. In this video, I'll tell you how to use niacin to cut down your arthritis pain significantly. Make sure you watch until the end to learn what dose you need to take for it to be effective, and one more thing you need to know before taking niacin. So niacin is a B vitamin that is an essential nutrient. We need it to function. It's involved in over 500 different chemical processes in the body. Not having enough niacin for these processes can cause disease, while restoring them can reverse disease. Severe deficiency can cause a lot of problems, including serious issues with your mental health, and can be fatal. But most people aren't dying of niacin deficiency. They simply could use some more to have some very positive effects. One of these effects is reducing and even eliminating the pain of arthritis. The trick is to dose it correctly or else it won't work, which I'll get to in a minute. Dr. William Kaufman was one of the earliest physicians to start treating arthritis with niacin in 1937. He had a patient with such bad arthritis in his elbow that he couldn't even lift his arm to get a blood pressure reading without significant pain. This doctor put him on high-dose niacinamide, and lifting the arm became no problem. To test out if this was really working, he switched the real niacin for a placebo, and the pain came right back. This doctor went on to use high-dose niacin to treat arthritis in hundreds of patients with great success. In general, he found that niacin improved joint mobility and muscle strength, and decreased fatigability and reduced or eliminated arthritic joint pain. But the key is in the dosage. It takes a high dose spread out over the day to have the best pain-relieving results. He recommends 250 milligrams every 90 minutes for a total of 10 doses. That's 2,500 milligrams a day. Niacin is very safe, much safer than over-the-counter medication. People do not die from niacin. In fact, it actually extends life because it also lowers your LDL cholesterol, the bad one, and raises HDL cholesterol, which is the good one. So remember, this isn't medical advice, so it's best to consult with your doctor before starting niacin therapy, especially if you have liver disease. And keep in mind, it can take a few months or longer of taking niacin to get the full benefit, but you should start to notice some improvement after even just a few days. Now be warned, if you take niacin, you will experience a flush. The larger the dose, the more of a flush you will have. It's okay to start with a smaller dose and work your way up. With a flush, you will feel warmth starting in your forehead, and it will travel down your face, neck, and upper body. Sometimes it will even go down to your toes. The first time I took niacin, it turned my whole body red. It will pass after 30 minutes or so, but most people kind of freak out if they aren't expecting it. It helps to take it with food, and you will flush less and less with each dose, and after a few weeks, most people have little to no flush response. To avoid the flush, you can take a non-flushing form of niacin called niacinamide. It is also effective in reducing arthritis pain, but some people feel the flushing form is more effective.